So, you know vitamin D is an important supplement that contributes towards bone development, and it could be important in the modulation and functioning of the immune system. Some think it's associated with a reduced risk of respiratory tract infection, and low levels of vitamin D has been associated with certain conditions called autoimmune diseases where the body appears to fight against itself. But how much vitamin D do we all actually need? And if we're already getting vitamin D from food and from sunlight, like I've mentioned in previous videos, do we need vitamin D supplements? Watch this video to the end to find out. Hi guys, I'm Dr. Sylvia and this is AskAwayHealth, where we provide you with direction and clarity about everything medical. Please subscribe to the channel so that every time we publish a new videos, which is usually once a week on Saturday, you will hear about it. Okay, so we know the different sources of vitamin D include food sources, your skin and sunlight working together to produce vitamin D, and vitamin D dietary supplements. I will put a link in the description for one of the videos where I talk in more detail about the sources of vitamin D. So, ultraviolet beta rays from the sun interact with a type of cholesterol in our skin to create vitamin D. This vitamin D is further activated in organs like the liver and our kidneys to the form where it's used to carry out the essential activities in our bodies. But let's look a bit closer at all these sources of vitamin D. When it comes to food, it's not always easy to get the amount of vitamin D that you require as a person from just eating a balanced diet alone. And some people might not even wish to eat the foods that we know contain vitamin D. People might have intolerances. People might have allergies. So that's not 100% route for getting all the vitamin D that an individual might require. And what about the sun? We're not all equally exposed to sunlight. Not only does it depend on where you live, but it also depends on your skin tone. So people with the melanin pigment in their skin, like me, will create less vitamin D because the melanin pigment absorbs the ultraviolet beta ray and prevents it from forming vitamin D from the cholesterol form under the skin. So people in that category, or people who can't access sunlight, for example, a person who is bedbound or has poor mobility and is unable to come outside as often as they would wish, or people who dress in clothing that covers up most of the body, or even people who use excessive amounts of sunblock, and so on. So these are just a few examples of people who will need to get their own vitamin D from other supplements to make up. Now, some foods, like I've said, are fortified with vitamin D. So of course, check the labels as you purchase to make sure that they do contain vitamin D and are contributing to your daily required quantities. So we've established that the dietary sources and the sunlight and skin sources may not be sufficient for one individual or the other, and that is why, yes, it is important to have dietary supplementation of vitamin D to ensure that you're getting the right amount and are not at risk of developing low vitamin D problems. So let's have a look at the recommended quantities, starting with babies and young children. Now, I have looked at guidelines for the United Kingdom, so please make sure you're checking guidelines for your own part of the world, or have a chat with your doctor or health provider about recommended quantities for your area. At birth, babies have limited vitamin D stores from that which has been transferred from their mother. So it makes sense that if mom has low vitamin D levels, then the baby is likely to be deficient in vitamin D starting off. So after birth, a baby will have the following sources: breast milk, formula milk, which is often fortified with vitamin D, exposure to sunlight, and dietary supplements. However, in some parts of the world, there is insufficient sunlight or ultraviolet there is insufficient sunlight or ultraviolet beta light to allow the formation of vitamin D from our skin, especially during the late fall or early spring period. And these are places where the latitude is above 37 degrees north or above 37 degrees south. And we've talked about how melanin pigment in dark skin tones can prevent the absorption of ultraviolet beta rays and the formation of vitamin D. But a similar problem could arise in lighter skin tones because of the advice to use sunscreen or wear caps over babies to prevent harsh sunlight, or to cover babies up when they're out in the sun because you don't want them to be exposed excessively to harsh sun rays. And so these are some of the reasons why in the United Kingdom, babies under the age of 1 should have daily vitamin D supplements to ensure they do not become deficient. The recommendation is for a daily dose of between 8.5 to 10 micrograms of vitamin D for a baby who is being breastfed. Now, for babies who are taking formula milk powders, the advice is slightly different, and this is because infant formula provided or used in the United Kingdom is usually fortified with vitamin D. And so it is recommended that they do not require a vitamin D supplement until they are having less than half a pint or 500 ml of formula a day. And the next category is for children between the age of 1 year and 4 years who should have a daily supplement containing 10 micrograms of vitamin D. And the exact same amount, that is 10 micrograms of vitamin D, applies to adults, children over the age of 5 and pregnant women who require to have daily supplements of vitamin D. So everyone should have a vitamin D supplement. Remember that you can have a blood test to check your vitamin D levels if you're not sure or if you think you have symptoms that indicate you have low vitamin D. And if the blood levels are low, you can be placed on a treatment regime that brings the levels back to what is normal and a recommended maintenance dose subsequently. Okay, that's it for now, guys. Thank you so much for watching. Let me know if you found this video useful in the comments. Don't forget to like and to share with somebody else who might find it useful. I hope you all will subscribe to the channel, and I will see you again in the next video.